All right, Ben, we are live. So thank you for sparing some time to come and chat to me again.
It's a pleasure. It's really nice to be back. I love what you do, and it's nice to be able to sort of talk across the airwaves and chew through relevant topics.
Yeah, definitely. So we've got a particularly relevant topic, I guess, today, which is going to be nutrition and micronutrients from a viral respiratory perspective. But before we dive into the topic, Ben, I know you've been on the show once before, but for any new listeners, would you be happy just to maybe do a quick intro to who you are and what you're up to and what you've done in the past, maybe?
Yeah, absolutely. So my background is naturopathic medicine, and I went quickly from clinical practice into more educational and research type roles, and have worn and continue to wear several hats. I've been involved in product research and development, so I've got a fairly intimate knowledge of nutraceuticals and herbal medicines and things. From that perspective, I should mention briefly, I'm a consultant for Pure Encapsulations, which is in part affiliation, but also just to disclose that potential conflict. Also, guest lecturer at several colleges that teach nutritional therapy across the UK, and sit on the scientific advisory board for BCNH, that's the British College of Nutrition and Health. I'm author of a few things, including a book, The Digestive Health Solution, now in its second edition. I have contributed to textbook chapters and also published research. So if you look me up on ResearchGate or PubMed, I've made several contributions to the scientific literature. I'm also contributing editor for Integrative Healthcare and Applied Nutrition, host of a podcast called Positive Podcast, and probably do other stuff I've forgotten for now. And that's kind of enough. So
Yeah, that's a lot of hats.
Bit of background, yeah.
Brilliant. So where do you feel the best place to start today has been in regards to the conversation? Is there kind of a natural route into this?
Yeah, I think it's really circumstantial that we're talking about respiratory viral infections because of what's going on in the world right now. But I think importantly, we want to place this discussion in context and talk bigger picture about the relationship between nutrients and respiratory viral infections more broadly, because what we're currently dealing with is a novel virus. So we don't know a lot specifically about that, but what we do know a lot about is, and this body of evidence has been building for decades, literally, is the relationship between nutrients, nutritional status, and your susceptibility to not only the initial respiratory viral infection, but also its complications. And this, perhaps surprisingly for some listeners, is quite a well-studied area, and there are quite a few nutrients that stand out because they've undergone a really large amount of mechanistic study, so we know how they're working potentially. Often it's complicated and there are several explanations, but it's really fascinating. And then in some cases there is epidemiological or observational evidence, so that's sort of population data where we're looking for relationships between things like dietary intake or exposure and risk. And we also have for several of these nutrients human clinical data as well, both preventative data looking at whether or not they increase your resilience or resistance to infection, but also clinical data in which we've looked at things like susceptibility to complications from infection. And I want to emphasize that as distinct, because that's really where the risk comes from, is whether or not you develop acute respiratory distress syndrome or pneumonia or some of these more serious complications. I mean, for most people, a viral respiratory tract infection is a relatively benign, self-limiting disease that resolves. But for some of us, it can be problematic and result in these complications. So I've become increasingly interested in this as things have unfolded more recently, and have been writing up a series of editorials on the relationship between micronutrients and these kinds of viral infections. And there's a lot we know, and some of the nutrients that stand out are things like vitamin C, vitamin D, zinc, which sound very sort of commonplace, but are really fascinating to talk about and better understand the evidence there. But winding it back a little bit, I just want to say this to sort of set the scene, is that I had no idea before looking at viral respiratory tract infections that they're amongst the top 5 leading causes of death globally every year. And
Wow.
this is true in the UK where we are. I just thought, cancer, heart disease, diabetes, dementia, we always hear about that. But it turns out that common flu, and the coronavirus is not flu, but there are interesting similarities, I should say, around the pathophysiology and the clinical symptoms and nature of these illnesses. So I'm not comparing them directly, but I had no idea that something like the common flu is one of these, results in so much mortality every year, and of course morbidity. We don't tend to think of it because it may not be as serious as other illnesses, but it just is not talked about. And it turns out that one of the reasons we don't know this, I didn't know this, is because researchers are not getting the funding, and we don't, it's just not being well studied. I think that's about to change.
Yeah.
But it's just really fascinating that it's such a big problem, but no one really knows about it.
That is amazing.
About it. Yeah. So
interesting.
So it's a big problem. It's been here forever. This one is particularly bad because the COVID-19 epidemic is really the problem with it is it's in terms of mortality, is from what I understand, I'm not a virologist, I'll put my hands up, but in terms of mortality and morbidity, it's not necessarily worse than an influenza pandemic, but it's far more infectious. So what we're really seeing here is something that's spreading across the population globally in a way that is very unusual, and it's become more deadly for that reason more than anything. So it's really is a unique viral outbreak, of course, but it is analogous to things that we see every year. We see widespread death from viral respiratory tract infections quite regularly. The coronavirus deaths have outnumbered some of the worst epidemics in the last 10 years of flu, but it's at the moment it's sort of sitting just above similar levels. It will obviously get worse. But so it's a huge thing, and I think that's a really interesting thing to understand, because it places it a little bit in context and says, well, we've had this huge problem for a long time. There are groups that have been looking at it. It's been sort of overlooked and neglected, but now that we've got something particularly virulent, we're paying a lot more attention, and I think we will be moving forward in science and medicine. I think this is a game changer, and in the way it's playing out. And the crazy thing is it's likely to happen again. Again, I'm learning as I go around these epidemics. It's not my specialist area, but it turns out, it seems from the best investigators in this field, is that this is a predictable phenomena. I had no idea. I probably would have said it was a conspiracy if someone said this was going to happen 5 months ago, but it's been thought about and predicted for a long time, and the reason we think this is happening is because of increased human population density and environmental degradation and animal husbandry. Because all these recent viruses, SARS, swine flu, the HN1N1, have all been outbreaks from proximity to animal species. So it's very likely with industrial farming and environmental degradation, because these viruses live in ecosystems, and when we infringe on those ecosystems, we come in contact with them, and it results in outbreaks. It's just predictable based on our current society and the way humans are interacting with the world and the population density globally, is that this is going to happen again. So I think people are going to take a bit more notice, given that we've had this experience. And we've had similar things before, like swine flu and previous SARS outbreaks, but it's what's really changed is this virus is a little bit different, but also our population density, even compared to just 10, 15 years ago, is really different, and our travel habits are really different as well. So it's, as we become more populous, better connected, we're more susceptible to these outbreaks. So I think really where I'm going with all this, it's really fascinating for me to think about how this sits in context of illness in general and viral respiratory illness. And then that gives you a bit of, a foundation for better understanding this as being something that's a bit more tangible, that we know something about, versus a deadly miasma that's going to attack you if you go outside. It's, because that's partly what the media is portraying. And, I totally understand that from a population health perspective, but it's, I think, also just important to place this in context. And I think that's what scientists do well, the media less so. But not everyone has the privilege of being able to read scientific journals and updates on this. It's like, if you're reading the mainstream media, it gets really scary. And, it often lacks context, but that's nothing new. That's true of most science reporting in the media. It lacks context. Yeah.
I think that's a really, really important message around kind of the virulence element of it, because it does provide such important context to what's going on. And I find it very sort of weirdly, for maybe one of the better word, comforting, just to kind of understand even that one element in a bit more detail, and why it's such a problem, I guess, globally. It's not necessarily a more sinister infection, it's just more virulent.
Yeah, absolutely. And I think placing that in context, I think the virulence and its ability to affect people has some interesting relationships that I think are very relevant to what we do. And by that I mean nutritional and lifestyle medicine. And what's I think will emerge with this, if I had a crystal ball, is we'll start to, as we gather data, we'll work out why certain people are more susceptible to the illness. At the moment, we don't have loads of clues, but they're emerging. And very early on, we knew from the data that was coming out of China, and we've seen this mirrored everywhere else now, is that age is a huge factor, and so is what they call medically comorbidities, which is a stupid word because I think it clouds what they're actually saying, and they're just saying sickness. And comorbidities, like, as you know, just means you have loads of illness. So it's likely you will have diabetes, cardiovascular disease, high blood pressure, be on multiple medications, maybe have cancer, or be undergoing treatment, or have a pulmonary disease or asthma, or, so it's like, and often it's multiple of these. So it's like more than one. And so I think the average, don't quote me on this figure, but the average age of mortality as well was around 70, 80 years of age as well. And we've seen that play out in places like Italy, and less so in the US, but we have a lot more younger people with multiple morbidities. So they're an unhealthier population, arguably. But again, that's conjecture. We'll find out later when we have more data. But I think this is all interesting because it then raises the question, well, what are the risk factors? And when you look back at the research on viral respiratory tract infections in general, well, we know that there are environmental factors, there are societal or socioeconomic factors. So we've known for a long time that the people who are susceptible in general to viral respiratory tract infections, not COVID-19, are elderly with suppressed immune systems, people with multiple morbidities, respiratory disease, but also they're, low socioeconomic groups, and, people like smokers, of course. And interestingly, in terms of nutrition, we've all, often known that there's a geographical and seasonal relationship. and that is often a proxy for vitamin D as well. So, and we're seeing many of these things play out with the current epidemic. And interestingly, there's also genetic factors as well. So this is early days stuff, but there's a group here, I believe, at Imperial College that have been looking at genetic associations before the outbreak, just with respiratory viral infections, which could be anything, but could also be coronaviruses. They're a relatively common type of virus, and that infect humans. And and certainly there seem to be genetic connections. So and interestingly, often the genes that are involved are those involved in vitamin D metabolism. So it's, genetics, environment, lifestyle, state of health, nutritional status. It sounds like functional medicine to me. And and this is outrageous, and I'm not the first person to say it and put it out there, but Jeffrey Bland got in early on this, and as he always does, and had said something along the lines of, this is the current epidemic is a lifestyle related illness, and we need to start thinking about it like that, which at first sounds a bit shocking, sounds a bit ludicrous, and sounds almost inflammatory when what we're hearing in the media is lockdown, wait for a vaccine, is that, well, maybe there are other things we need to be considering that are within our sphere of control. And I think that's a really powerful statement, and also incredible food for thought, is, well, actually, are there things within our control, our lifestyle and our nutritional exposures included in that could increase our resilience to infection? And I think there is. If you look at some of the previous work that's been done on nutrients and viral respiratory tract infections, I think it's pretty clear. And vitamin D is the classic example of that, because we know a lot about it. I've no doubt there are other nutrients that are just as important, but we know a lot about vitamin D. And I think that'll become a bit of a Trojan horse for nutrition and viral infection susceptibility, because it's going to become pretty clear pretty quick. We need to do something about widespread vitamin D deficiency in high-risk populations, because they're going to be more susceptible to contracting the illness, but also severe complications and possibly death. And I think, that's no small statement, but I think it's absolutely true. So it's fascinating to watch this all unfold. And, I think there's a huge role and potential here for functional medicine and nutrition and lifestyle medicine to not only, to increase our resilience and protect us against this kind of thing. It's huge. And I think, we as a sort of, ecosystem of practitioners and industry and policymakers and anyone who's remotely involved in this sort of area, have a huge responsibility to step up and talk about that.
Yeah, no, absolutely. I think that's a good point. And I guess one of the challenges there's been so much conflict in some of the information out there within our sort of field of functional medicine, nutritional therapy, that I think it's left a lot of people, practitioners included, confused, and I guess also a little bit concerned around making inaccurate recommendations.
Right.
So I'm really excited to kind of dive into this a little bit more with you in regards to these micronutrients and what you've sort of seen in the research. So we can, if nothing else, feel a bit more confident in what should be relatively, you would have thought, straightforward sort of interventions and things for us to be exploring.
Yeah.
So with that in mind, obviously you've mentioned vitamin D being of significant importance. And as you say, there's been that sort of correlation between, I think even sort of time of year and some of these epidemics that have pointed at that over the years. What are some of the other well-researched micronutrients that you would be going to after that?
Yeah, it's a good question. And there's really a few that I've been looking at in a bit of detail that I think are really relevant. And there's sort of strengths and weaknesses to what we do and don't know about them. So I'm certainly would rather talk about nuances than this is just what to do.
Hmm.
But I mean, a classic one that certainly has some really interesting strengths and weaknesses about what we do and don't know is just simple vitamin C or ascorbic acid. And you know, this one is particularly controversial. I mean, there are others we can jump into like zinc and vitamin A and you know, there's some interesting connections with N-acetylcysteine as well. But vitamin C is, you know, really interesting because it's quite controversial still to this day, and there's a reason for that. Largely because some of the initial theories around vitamin C and its ability to fight infection have never been properly tested, and also because there appears to be an inherent bias against vitamin C itself and the use of vitamins in general, medically and in scientific literature. And it's not just me thinking this, it's also leading vitamin C researchers, is that it just seems to be neglected and often dismissed as being beneficial. But there's quite a lot of lines of evidence that suggest it would be really, really useful. And it is in fact being tested at the moment in a few clinical trials, or at least one that I'm aware of, and no doubt there'll be others for severe COVID symptoms, but that's intravenous. But getting back to the history of it, I think is really fascinating. Is vitamin C was first proposed to be useful for the common cold, infamously by and popularized for this. It was actually proposed for viral infections about 20 years earlier, but it was popularized by Linus Pauling. And you know, he wrote a book, I think, the vitamin or the cold cure or something like this, and that really put him out on a limb, and he attracted a lot of criticism for that, despite being still the only person to win two Nobel Prizes in two different areas. It's not the, you know, he knew what he was doing. He's a very intelligent guy, and he had this theory around vitamin C that, you know, he had lots of really great theories around vitamin C, that we needed a lot more than the RDA or NRV, we now call it. And he published some really cool calculations around what we probably should need. But he also had these ideas around infections. And his theory ultimately, just for simplicity's sake, suggested that you needed big gram doses to kill a pathogen, basically. So he was really proposing upwards of like close to 15 grams a day of just pure ascorbic acid. You know, it sounds like a lot, but it's like 3 teaspoons of, you know, if you've got ascorbic acid powder, it's not that unachievable. And the crazy thing is that although he had this theory and he, you know, claimed that colleagues had tested it, it was working really well, and you know, people have been using this. Like, I know doctors that picked up on this work 30 years ago and are still using this in practice, and you know, it works according to their anecdotal reports. But the bizarre thing is no one's actually ever properly tested it. So there definitely have been loads of human clinical trials on vitamin C for the common cold. But the curious thing about them all is they all use relatively low doses. Not one of them uses 15 grams. Only 2 of them use up to 8 grams. And most of them are using below 1,000 or 1 gram, 1,000 milligrams. So arguably, we've never really tested his theory. But what we do know from the evidence that does exist is it looks like vitamin C will work to prevent and treat respiratory tract infections in certain subgroups at these lower doses. It also looks like there's a dose-response relationship. So you give vitamin C to kids and they respond better because they have a lower body weight at what is respectively a higher dose. And there are a few old studies which tested like 8 grams a day, and they saw, you know, from 4 to 8 grams, they saw a dose-response relationship. We also know that you can achieve much higher blood levels by taking gram doses as well. The other interesting thing about vitamin C, and I think this is grossly overlooked, is that a lot of people are deficient. You know, people think of vitamin C deficiency as being, you know, related to scurvy, which is very rare, you know, in modern society. But when you look at plasma vitamin C as a barometer, so a very robust, it's objective barometer of ascorbic acid exposure and blood concentrations, quite a few authors have suggested that below 28 microgram of, moles per liter is representative of deficiency. And when you use that as a cutoff point, basically 10% of the general population are deficient, 30% of cigarette smokers, 30% of the elderly. And then when you go into hospitals and check people, it's like 60%.
Wow.
So it's a really common phenomena, weirdly, for people to have relatively low blood levels of ascorbate. And, we're just, I think, kind of overlooking it. The other really interesting thing about vitamin C, and this is independent of its relationship to common cold or the flu, is that it actually has been shown to prevent pneumonia. There are a small handful of trials in looking at that. That's a severe complication, mostly due to respiratory viral infections. And what are we doing about that? So, certainly there seems to be all these lines pointing to, well, we've got, we know it inhibits viruses, it supports immune function. We've got all these lines of evidence, including human clinical trials, although they're a little bit limited. We've never really tested Pauling's gram doses for treatment. We know high risk groups for viral complications, like smokers and the elderly, are the most at risk of deficiency of vitamin C. So, why are we not seriously looking at this and testing it? And it's a bit of a shame, but it's, in my mind, it's certainly got potential, and it's low risk. It's pretty inexpensive. Why not take it as a preventative, especially if you're at high risk, and if you are getting symptoms, there's absolutely no harm in trying it. It's benign. There are no side effects, and there seems to be a likelihood that it could benefit you. So, it's a really interesting one, because there's still a lot we do and don't know, and a lot that remains to be tested. But there is quite a bit on vitamin C that deserves attention. And, I saw a recent comment from a scientist based here in the UK who's got a bit of popularity on social media, and they'd taken a picture of some vitamin C in a shop window and asked the question, which was a bit rhetorical because I know what they believe. And it was vitamin C or something along these lines gained in popularity, but is it just an expensive placebo? And what I just don't understand about that is, like, how can you make that sort of comment as a scientist without seeing the evidence there? Like, even if we don't have the clinical trials, there's a huge preponderance of evidence to suggest it could be at least a benefit. And why just blazingly dismiss it? And but we've seen that a lot over the years with vitamins.
No, it's tricky. I think it's really interesting though to kind of hear that story of vitamin C and kind of how it's developed and what research is out there. I think the only thing I'd add is, and I'm not sure if it would happen at 15 grams a day, but the one potential consequence is just going to be loose bowels. If you go too high. There's I'm not sure if you've ever done the vitamin C flush, Ben, but it was a fun experience.
Yeah, that's a very good point. And I did fail to mention that is the most common side effect of high oral vitamin C is loose bowel movements. That does tend to happen above around 7 or 8 grams. So if you're taking lower range doses, you're probably fine. And there was some really interesting work that was done about 20 years ago by a scientist. I've criminally forgotten his first name, but his last name was Cathcart. And he published in a lot of mainstream medical journals of the day these cool theories, and he also tested it in thousands of patients. And this is where the idea of bowel tolerance with vitamin C comes from. And what he was at least able to demonstrate in his research is that if you need vitamin C, it's less likely to cause diarrhea, basically. So these high doses for people who are sick are much less likely to cause a loose bowel movement. But It's one-off, and I agree. I think it sort of varies. I think it's a bit unpredictable with higher doses, but if you are thinking of trying it and are concerned about that, if you keep it to around 8 grams a day maximum in divided doses, so 2 to 3 doses spaced throughout the day, you'll safely avoid that.
Yeah, I mean, to give personal context to this, I've tried the vitamin C flush before, and that's the guidelines I was given was 5 grams of vitamin C every half an hour for 2 hours, and then if you haven't had a violent bout of diarrhea by then, you go to every 15 minutes.
Wow.
So I got to about 45 grams of vitamin C before it happens. So
Wow,
you're
that's
probably going to be okay.
Yeah. Yeah, absolutely. I've taken really high doses, like for various reasons, and never had that experience. It just seemed to no problem.
Excellent.
Yeah.
Good. So I think we can check vitamin C off the list. What have you come across from a zinc perspective? Because that's definitely one that I guess I've seen on social media and things being discussed, and colleagues I think have referred to it as probably being potentially the most, what's the word I want to use? Well, kind of safest, like non-debated nutrient when we're thinking about viruses and immunity generally.
Yeah, it's probably some truth to that, because zinc has a long history of research in chronic viral infections. In fact, outside of respiratory infections, or more broadly, I should say, beyond just flu and more specifically the coronaviruses, there are human clinical trials in rhinovirus, common cold, viral warts, HIV, even chronic hepatitis C. So it's had a pretty broad level of interest across different viral diseases over the years. If you narrow that down to just the common cold, for example, there have been at least 15 human clinical trials in that area, and generally they've found a positive effect. So the general consensus is that if you start taking zinc acutely when you get a cold, you will cut your risk of having symptoms in half over the next week, basically. So it's certainly up there, and the mechanisms are really interesting. It does have direct antiviral effects, probably not how it's working in the human body, but as we know, zinc's involved in pretty much everything. So it's obviously going to play a really important role in immune system function. And, I think that's really in general what nutrients are doing anyway, isn't it? They're just supporting our body's remarkable ability to deal with infection. That's what, from an evolutionary perspective, it's been argued that that's what our body is designed to do. Like, it's created to fight viruses. There was a great book on this I read years ago by the evolutionary biologist Matt Ridley called The Red Queen, and his argument is that human biology is just in a constant arms race against viruses, and we're really, really good at it. And the reason I mention that is because I kind of think of that as how nutrients are working. Like, you're just kind of giving your body the fuel it needs to do its own thing, and if you're deficient in these things, it can compromise immunity. And that is certainly true of zinc. When you look at zinc deficiency, you can see lowered immune function. And conversely, when you take people at high risk of deficiency, particularly elderly patients, and this has been done in human clinical research, when you give them zinc, you see improvements in their immune function and different immune parameters like reduced oxidative stress, lower circulating inflammatory cytokines, and then this also translates to reduced infection incidence in these populations as well. And further to that, there have been relationships between low zinc status in the elderly and developing pneumonia due to this compromised immune function. So it's certainly got some pretty strong support for its use as an intervention, and sadly that's not, to my knowledge, being picked up currently as a safe, potential intervention to help improve resilience. But it's, I do know there is one hospital in Austria, I believe, that is utilizing zinc in a medical setting at the moment for COVID patients. But, it's a rare example, unfortunately.
Yeah. And off the top of your head, can you remember kind of what doses have been discussed?
Yeah, absolutely. The dose history of zinc in clinical trials is interesting. A lot of the early studies used very high doses, like above 100, 75 to 120 milligrams per day. Would definitely advise against that because you could puke, basically. And one of the main side effects of taking too much zinc is you feel nauseous. So the general rule for avoiding that is don't take more than about 40, 50 milligrams in a single dose. If you're taking more than that, divide it across the day. Most commercial products won't ever recommend that much in a single dose anyway, so you're very safe using products and following label recommendations. But subsequent to these early trials, I think researchers eventually cottoned on, after about a decade of people feeling sick, that you can give less, it works just fine, and you don't get the nausea. So more recent trials have tended to use more around the 30 to 45 milligram mark, I would say, in general. But that's for people who are at risk of deficiency, like elderly patients or, in particular. I think for your average person who's omnivorous, so meaning they do eat some animal products because it's one of the main sources of zinc, and eating a relatively healthy diet, you could probably use a bit less, like 15, 25 milligrams. I think it'd be a nice sort of general dose for on the background of a relatively healthy diet. But if someone is at risk of low intake or absorption, around 30 to 45 milligram would make sense, in my opinion.
Okay, brilliant. And anything else that you just want to touch on from a zinc perspective that you haven't yet mentioned?
No, I think that's pretty much the story with zinc. It's it's, I mean, one of the interesting things is that it is generally thought to be fairly sufficient in the general population. I think, when thinking about nutrients, it's, sufficiency is one thing, but sometimes using them almost like a medicine is often how we're using them. And, I think that dialogue that, you can get everything you need from food is really valid. But at the same time, we don't use nutrients clinically just to treat deficiencies. Often we're giving them, and vitamin C before was a classic example of this, giving them almost like a medicine, in that we're giving a higher range dose for a specific effect. And I think that's true of zinc, is although there's a general consensus that across the UK it's rare to see suboptimal intakes, I think there's still merit in considering it as a way to optimize immune function and health in people in general, but certainly in high risk groups. So I think that's food for thought, and I just think it's relevant because I hear this a bit around nutrients in general, but this is true of zinc as well.
Yeah, no, I think certainly looking at testing in clinic, zinc is probably one of the more common ones that I see where there's an additional requirement for. Bearing in mind, my clients are often the unwell. But yeah, it's definitely something to be mindful of. What about vitamin A then, Ben?
Well, that was an interesting one. So I set about writing up an editorial on this recently, and what surprised me actually is that although there's a lot of I noticed a bit of noise around vitamin A in more social media and sort of popular press and magazines and things at the moment, because it's like vitamin A equals immunity, get some vitamin A is kind of the story. But it turns out that we do know a bit about vitamin A and its relationship to viral respiratory tract infections. And it's a sensitive one in that taking high doses might increase your risk and prolong the illness. And I don't think a lot of people know that, because I'm not seeing it anywhere. It's more the dialogue is take vitamin A, it's good for your immune system. That's partly true, but it seems that there's a tight sort of relationship between optimal and too much could suppress it, immunity. And we see that with some nutrients like selenium and iodine. There's a fairly tight curve between what's optimal and what's not optimal and what's toxic. So it's sort of a bell curve, and on those particular nutrients there's a narrow sort of window. It seems true of vitamin A, and basically where we know this from is that historically vitamin A, most of the research has been in developing countries where there's night blindness, which is related to vitamin A deficiency, poor pregnancy outcomes due to malnutrition, increased deaths from infections from things like worms and parasites, which is also related to vitamin A. And vitamin A saves lives. It's a fact. Groups that are doing vitamin A repletion in developing countries are making a huge difference to human suffering. But from that, in that setting, we're talking about something a little bit different, because they're giving very high doses, often once a year, because that's just the nature of how it's administered, and it's more practical that way. But they're often like a single dose of like 50 to 200,000 IU, maybe every 6 months or something like that. And what's really interesting is in those groups there has been study on whether or not those vitamin A supplementation programs will actually reduce pneumonia or respiratory tract infections, because it's a big problem in malnourished people as well. And basically it doesn't. So when you analyze all the data, and there's multiple studies in this area, I've not done this, but there are meta-analysis that exist. It just doesn't seem to really protect people from things like, pneumonia, for example. And the same is true of lower respiratory tract infections. I mean, it just doesn't really seem to be very protective. In fact, it may increase lower respiratory tract infections. And digging a little bit deeper into this, we've got to ask, well, why is that? Like, how could vitamin A, is there even a reason, or is it just a chance association? And it turns out that when you give vitamin A, even in sort of moderate doses, so this has been done at a dose that's quite relevant to supplementation that we might use, like 800 RE or micrograms a day, you see a slight suppression of immune function. So certain T cells and stuff will drop. And so there's quite a good rationale for this, is if you're giving really high doses of vitamin A, it seems to depress immune responses. And this would then explain why, in some studies we're seeing increased risk for infection. So the really interesting thing that adds a little bit of clarity to all of this is that it appears that vitamin A is more likely to be protective. So it may actually reduce incidence of infections in people, and this is more so data from children, that are really nutritionally compromised. And what this is suggesting, and we've seen this mirrored in animal experiments, is that if you're vitamin A deficient, vitamin A is probably going to be helpful to a degree. But if you're relatively vitamin A replete, vitamin A could suppress your immune function and prolong infection. So what do we take from all of this? And what I think we take from it is, well, don't just latch onto vitamin A supplements and take loads of them if you're feeling sick, because it could actually suppress your immune function and make you a bit worse. What you want to do is make sure your vitamin A intake is optimal, but don't take too much. And, vitamin A is sadly a bit overlooked because of it has a bit of a history of being associated with toxicity, which is really unfair. it's very hard to achieve vitamin A toxicity, and a lot of the studies with those relationships are inherently flawed and have been criticized.
Okay.
But unfortunately, it sort of wears this halo now of vitamin A dangerous, and it's sort of been engineered out of supplements. Even like it's even hard to find vitamin supplements that use actual vitamin A. They all use beta carotene because it's safer, but a lot of people can't convert it to vitamin A. So you have this sort of conundrum where people are scared to take it, and also our supplements don't have it, and we don't eat the foods anymore anyway because they've gone out of fashion. Like, who eats liver and brains and offal anymore? Because that's where all the vitamin A is in our diet. It used to be a really integral part of our diet. We're eating these foods regularly, but they're gone now. And in fact, people are often scared to eat them because they think they're going to get sick from vitamin A. You know, it's so it's commonly deficient. We need a bit, but not too much. And, you know, keep an eye on supplements, because most of them are not using preformed vitamin A. There is a genetic inability to convert beta carotene to vitamin A that's often overlooked. So people could be insufficient for that reason. And people are just not getting it from food because we don't eat vitamin A rich foods anymore.
Yeah, I was going to kind of flag the food element of things, because I think that's such a big part of it. Fortunately, I love liver, so I'm one of those few that love it. But
you got lucky, because I remember studying nutrition, like, and all the classic old school nutrition textbooks. When you look at like what's a good source of this vitamin or fat or mineral, it's like always liver. Like all the B vitamins, all the choline, all the fatty acids, you know, certain minerals, like iron, like everything's in liver.
And I definitely
like
feel
superfood.
That. Yeah. I mean, when I eat heart, for example, I generally think I feel different afterwards. There's almost like an energetic shift from that just nutrient dense organ.
It's a very primal hunter-gatherer experience.
But it's for people listening, I guess I would recommend heart over liver. I think from like a taste and texture perspective, it's much more palatable, I guess. But in your reading, Ben, did you come across anything from the sort of the vitamin A, vitamin D connection? I know Chris Masterjohn talks a lot about vitamin A toxicity is partly dependent on vitamin D status. Did you see anything around that concept?
Yeah, I don't know a lot specifically about this. I know there was some connections made between this relationship and osteoporosis in Nordic countries, in which cod liver oil, which inevitably contains a ratio of vitamin A to vitamin D because they naturally occur in there, was associated. So early life supplementation was associated with later life development of osteoporosis. And there was some thought that there was a connection between that observation and the vitamin A, vitamin D content of these of the supplements in early life exposure. But it's I don't know enough specifically about it to comment, and I also don't know how relevant it is outside of that context as well. But it's interesting. Like, you know, often there are interrelationships with nutrients, and you know, you need a bit of everything, basically. Is what it often
takeaway message.
Is often what it comes down to. It's like, you know, you can dive in, like the vitamin K, vitamin D relationship I know more about, and it's really interesting, but the takeaway is you need both. And, if you're deficient in vitamin K, that's a problem. It's not the vitamin D that's the problem, and it probably isn't the vitamin A or D that's the problem either. It's that if you're low in one, you'll get complications that have some interrelationships with others. So it's an interesting question, but one I can't really answer.
No, that's appreciated. And I think, you know, the more that I read, and I guess some of the exposure I get from social media these days, we just need to be outside more. We need to be going. we need to go back to kind of how we used to eat.
Pretty much.
There's some basic things we can really focus on here.
Yeah, I think you're right, and I think, you know, one of the problems with nutrition always and will always be a problem is that it gets too complicated and too reductionist. And it's one of the beautiful things about nutrition. Like, I love reductionist nutrition and the nitty-gritty science, and it's so interesting. But it's also one of its great fails, in that reductionism has resulted in a lot of misconstrued knowledge and advice, that even at a public health level. I mean, look at the cholesterol story. I mean, wow, that's like 40 years of bad advice that's now being flipped on its head at a public health level, because we just got some mechanisms and associations wrong, and what a mistake that was, and probably altered the human diet in a way that favored sugar, which is even, so it's like huge ramifications. And I think, bringing it back inevitably to things that are inherently boring. You're never going to have a popular blog or podcast talking about the basics and fundamentals of nutrition that never change, but that's what counts. Like, it really is. You just need to eat a healthy diet, like minimally processed, and it's these simple messages that are most important, but they just don't seem to attract popular attention. Like, it's extreme crazy stuff that gets the attention.
Yeah, it does fascinate me, that, and I'm not quite sure why, but a great example is, I was stumbling across research on Monday talking about sort of sunshine exposure from a human microbiome perspective, from a liver inflammatory perspective. And you just start to, you go back to, we just need to get outside more.
It's so true. It's like our gut microbiome has a circadian rhythm. Like, that's great. So I should go outside. It's funny, isn't it? Like, I think there are a few immutable fundamentals that will never change. And it's interesting to look at them through the lens of other things, but it can also cloud it a little bit. Like, who cares if your gut microbiome has a circadian rhythm? Like, is that actually clinically relevant? Can you affect it, change it? No, not really. It's cool from a mechanistic perspective, but it's not going to result in really powerful clinical advice, and certainly not population level advice. So it's funny to place all this in context and sort of wind it back to fundamentals.
Exactly. I think, as you say, it's really fun to dive into it, but clinically it's not where we want to be going.
Well, that's true too. It just starts to cloud things a little bit.
I think it complicates it. It confuses both the practitioner and the client. And it, I think, often will just lead to paralysis by analysis kind of thing.
And sometimes these things don't add up as well. Like, a really good example of that using gut microflora is the gut microbiome connection. And, it sometimes just doesn't work. Like, there's famously, or maybe people aren't aware of this, but there's a world leading group at Cork that are, arguably the pioneers in this area. And they have this classic example I like to use, where they were doing all this mechanistic data, and everyone knows these studies, where they gave mice probiotics and they felt happier. And then they did things like severed the gut-brain connection, which sounds horrible, but that's what they did. And it's like, wow, there's a gut-brain connection. It's altering mood and da-da-da. And then, I don't know if people are really aware of this, but they went on to study probiotics in these animals, and it all just looked amazing. Like, you give a probiotic, it alters the gut-brain connection, and the mouse were less anxious. But then they took it to humans, and it just didn't work. Like, so you've got this beautiful, like, series of mechanistic understandings, and you take it into a human, and it just doesn't add up. And I think that's one of the mechanisms are really interesting, but they're also a shaky thing to base things on. It's like, you really want multiple lines of evidence. And, if getting outside is good for you, rationalizing it in ways beyond our microbiome is probably going to be more relevant.
And there's the good argument, I think, which is all of these sorts of studies are done in sort of artificial environments. You can take it to sort of just basically under blue light 24/7, and these kind of things that, again, will not really allow you to extrapolate it to how we have evolved in and the environment that we have evolved in.
Absolutely.
Classic example being comparing urban to rural populations from a microbial perspective and seeing the differences. So yeah, go outside in nature and
yeah,
that'll be a big difference.
Yeah, absolutely. Yeah.
Okay, so before we go on another tangent, what about NAC? That was the other kind of, I guess, big one that you mentioned at the beginning.
Yeah, absolutely. I think it's really interesting. I mean, I have a little bit of a bias here because was recently involved in a paper with Dr. Deanna Minnick on glutathione metabolism. If anyone wants to check it out, it's in the journal Nutrients. It's open access. We paid for it, so please make use of that hideous expense that you have to do to make things available. But it's so I was looking at this in the context of viral infections, and I think we're going to hear a lot more about this. Curiously, that paper, so as researchers, we get updates on who's citing it. And what is fascinating is that there are a few groups looking at the relationship between glutathione and COVID outcomes at the moment. And there seems to be something important going on there in that there have been at least 3 citations specifically on that topic. I've read 2 of them, but one of them was a case series that came out of a hospital and research facility treating these patients with severe complications, and they were measuring blood glutathione. And basically what they were able to demonstrate is that you can basically predict severe complications by just watching the glutathione levels drop. And so there's interest in optimizing glutathione metabolism for treating it, but also just infections in general. And we know that glutathione endogenously, we make it, it's just a natural thing our body makes, and it plays a really important role in immune modulation and function. And it turns out viral infections and NAC, or N-acetylcysteine, is a precursor to glutathione, but it does more than that. It has constitutive functions that are unique to NAC and independent of glutathione. And more broadly, what we know about NAC is it has important antiviral, antimicrobial effects, both directly and indirectly. It is mucolytic. There's some debate as to whether or not oral NAC will be mucolytic, because it's often vaporized and inhaled as a mist in conditions like cystic fibrosis. But you could imagine if there is a modest, even mucolytic type effect in a respiratory infection, it could be beneficial. And also we know that NAC has an interesting sort of tropho-restorative or protective effect on lung epithelial cells. There has been a little bit of human clinical work, but it's old and it's a little bit obscure and often overlooked. But it turns out that NAC has been shown in high-risk groups, like elderly individuals, to protect them against influenza infection. And what is really curious actually about this, there's one study in particular, there's a few in this area, but there's one in particular I'm thinking of that was done in Italy years and years ago. It was back in 1997. And what they were able to demonstrate is that, interestingly, the group that took NAC versus placebo, was a placebo-controlled trial, not only had less symptoms of flu, well, they had less symptoms of flu, but what's really interesting is that they didn't have less infection. So they measured viral infection by measuring, the virus itself. And what they were able to demonstrate is there was no less infection. They were just much more unlikely to get actual symptoms. So their immune system was just primed and just dealing with it effectively. And I think that's really, really fascinating. And NAC, beyond that, has been used for many years in respiratory tract disease to help protect against things like pneumonia and other illness. So it's certainly got a lot of support behind it as a potential intervention. It's fairly limited, but I think it has huge potential and deserves a little bit more, attention. It's simple, very safe, pretty cheap, and is likely to be of benefit. So there's something there. And for me, as a more sort of intervention, I guess you would say, for viral infections, I've sort of been recommending it for years for that, and anecdotally have just seen it work quite well to help reduce symptoms and alleviate reduce duration, alleviate symptoms, at least anecdotally. It's completely uncontrolled, but I like it as a sort of preventative but also treatment type measure in people who are developing symptoms or at risk.
Yeah, and it's fascinating in regards to kind of symptom severity and viral load, and shows us, I guess, the same with bacteria and parasites as well. That kind of relationship that we have with it is what matters ultimately, and that's dependent on things like nutrient status and our essentially overall immune resilience, I guess.
Oh, absolutely. I mean, that is such a powerful statement, because I mean, what we're ultimately talking about with all of this is that we're all going to be exposed, like viral respiratory tract infections, including the current one. And there's no way they're going away. We're not going to come out of lockdown and find a vaccine. Like, look at the history of vaccines for influenza. Like, it's not changed much. And I think it's unlikely that it will with this, and that this will be with us forever. And, the question then we've got to ask is, well, what increases our resilience to this? And you're absolutely right. It's not about the virus as the enemy. It's about understanding the dynamism between our biology, which is very good at dealing with viruses. I mean, as you know, we're infected with them all the time. In fact, I think there are stats like the average person has 7 at the moment.
Oh, really?
but they just don't know about it. Like, it's this constant war that's happening. And the same is going to be true of COVID. So the question I think we need to ask is, well, what are the virulence factors, or the things that predispose us to infection? And it seems that our state of health, our state of nutrition, our environment, and at a more almost like very big picture level, it's also the way we're interacting with the world around us: population density, travel, environmental destruction, degradation. Like, these are all big things that are part of the same picture, I think. So it's a good way to sort of close almost, and just give us all a bit of food for thought.
Yeah, definitely. I think that's a really powerful thought, and hopefully can provide some peace to some degree, just with a bit more clarity around the dynamic of it. So Ben, thank you very much for sparing some time to come and chat with me. It's always great to get your insight and wisdom.
Oh, thanks. It's a real pleasure. Really enjoy it, and it's nice to be able to explore these things with you.
If people have listened to this and they are maybe interested in sort of learning more or potentially reaching out, what ways that people can maybe follow you, for example, if there is such a way?
Yeah, no, there is several, but the easiest thing to do would just be go to my website, which is scientificwellness.com. And from there you can connect through to things like social media channels and other bits and pieces. So it's a good central point and branch out from there.
I'll put that into the show notes as well. So thank you, Ben. I think this will be a really warmly received conversation. So thank you for your time.
Pleasure. Thanks, mate.